नमस्ते दोस्तों, मैं आपका दोस्त प्राध्यापक सचिन। आज सोशल फार्मेसी का जो पेपर है कल का, उसके लिए इम्पोर्टेंट क्वेश्चंस है। तो आप ये रीड करना, सुनना अच्छे से और देखना भी वीडियो, पूरा वीडियो जरूर देखना। तो चलिए शुरू करते हैं वीडियो को।
10. Note on FIP development. The concept of health. 1. Definition health. Concept of disease. 2. Dimensions, types of health. 3. Note on mental health. 4. Explain various determinant, factor govern the health of individual. 5. Define indicators of health and give the characteristic of indicator of health. 6. Write a note on economic disease cycle. 7. Note on mortality, morbidity indicator. 8. Explain natural history of disease. 9. Define disease agent. Classify various disease agent. 10. Explain concept of prevention of disease. 11. What is intervention? What are various modes of intervention? Chapter 2a. Demography and family planning. 1. Define demography and objectives of study of population. 2. Define demographic cycle. Explain stages of cycle. 3. What is fertility and explain factors affecting fertility. 4. Note on family planning. 5. Note on family welfare program. 6. Define contraceptive and contraception. Classify methods of contraception. 7. Note on chemical conception. 8. Note on IUDs. 9. Note on hormone contraceptives, oral contraceptives. 10. Explain physical methods of contraception. Give the merits and demerits of condom, diaphragm and caps. 1. Explain permanent, terminal methods of sterilization. 2. Role of pharmacist in promoting family planning. 1. B. Mother and child health, IMP. Of breastfeeding, IL. Effect of infant's milk substitute and bottle feeding. 1. Note on mother and child health. 2. What are breastfeeding and importance of breastfeeding. 3. Ill effects of infant milk substitute and bottle feeding. See overview of vaccine, types of immunity and immunization. 1. Define vaccine. Types of vaccine with example. 2. Define immunity. Classify immunity. 3. Difference between active and passive immunity. 4. Prepare a immunization chart. National immunization schedule. 5. Define immunization and immunological products. Classify immunological products with examples. D. Effect of environment on health. 1. Define water pollution. Causes, sources and control measure of water pollution. 2. Define air pollution. Composition of pure air. Mention function. 3. What are causes, control measure of air pollution. 4. What are immediate effect and delayed effect of air pollution on human health. 5. What is noise? Auditory and non-auditory effect of noise. Preventive measures to control noise pollution. 6. What are ill effect of sunlight? Various methods of control them. 7. What are different sources of water supply? Note on sources of water supply. 8. Different methods of purification of water. Explain methods. 9. Describe design and mechanism of septic tank. 10. Describe purification of water. Explain methods of purification on large, small scale. 11. What is sewage? Explain sewage biological treatment. Solid waste. Sources, hazards, methods of disposal of solid waste. 13. Explain methods of excreta disposal and important features of RCA latrine. 14. What are different types of well? 1.5. Define ventilation. Explain types of ventilation. 1.6. Note on occupational illness. 17. Write a note on environmental pollution due to pharmaceuticals. E. Psychosocial pharmacy. 1. Define psychosocial pharmacy. What is drug abuse? Give reasons of drug addiction. 2. Note on drug addiction. 3. Note on alcohol addiction. 4. Note on tobacco and tobacco-related product. 5. Effect of drug abuse, addiction on social health. Chapter 3. Nutrition and Health. A basics of nutrition. 1. Define the terms, nutrition and food. Mention functions food. 2. Write classification of food material. 3. Define protein. Give sources and functions of protein. 2. 4. Define essential and non-essential amino acid. 5. Define and classify protein with examples. Functions of protein. 6. Define and classify amino acid with examples. Functions of amino acid. 7. Explain kwashiorkor and marasmus disease in detail. 8. What is malnutrition and explain protein energy malnutrition (PEM). 9. Define and classify carbohydrates, lipids, minerals, vitamins with examples and functions. 10. Give requirement, deficiency defect, sources, and function of following minerals in human body: I, calcium E, iodine E, iron IV, phosphorus. 11. Note on balanced diet. 1. 2. Define and classify vitamins. All vitamins sources, requirement, deficiency and functions of all vitamins. 13. Note on nutrition-related programs developed by Government of India. 14. What is ORS, and give its composition. 15. Note on beriberi, pellagra, egg white injury. The importance of water and fibers in diet. 1. Importance of ware and fiber in diet. 2. What are dietary fibers? Give sources and types of components of dietary fiber. C. Balanced diet, junk food, fortification of food. 1. What is junk food? Mention ill effect of junk food. 2. What are the measures to be taken avoid junk food? 3. Write a note on fortification of food. D. Introduction to food safety. 1. What is food safety? Describe various way of food safety. 2. Note on food adulteration. 3. What is artificial ripening and what is effect of artificial ripening? 4. Note on pesticides and write advantages, disadvantages of pesticides, and write hazards of pesticides on human being. 5. Write note on genetically modified food. E. Dietary supplement, nutraceuticals, drug-food interaction. 1. What is nutraceuticals and classify nutraceuticals with examples and also importance of nutraceuticals. 2. Write a note on dietary supplement. 3. Write a note on drug-food interaction. 4. Write a note on food supplement. Chapter 4. An Introduction to Microbiology. 1. Define microbiology and microorganism. 2. Define and classify viruses, and list living and non-living characters of viruses. 3. What are stain, dye? What is purpose of staining, types of staining? 4. Note on Gram staining. 5. Explain Ziehl-Neelsen's acid-fast staining method. 6. Define isolation. Explain various technique of isolation of microorganism. 7. Note on streak plate and pore plate method. 8. Describe structure of bacterial cell and virus along with diagram. 3. B. Epidemiology. 1. Define epidemiology. Give the major uses of epidemiology. 2. Define the term. 1. Infection. 2. Infestation. 3. Communicable and non-communicable disease. 4. Epidemic, endemic, pandemic disease. 6. Zoonotic disease. 7. Host. 8. Fomites. 9. Eradication. 10. Reservoir. 11. Vector. 12. Isolation. 13. Outbreak. 14. Quarantine. 15. Medical entomology. 16. Carrier. 17. Antiseptic and disinfectant. 3. Describe methods of transmission of communicable disease and give the examples of various dynamics of disease transmission. 4. Explain types of host, reservoir, carrier. 5. What are hospital-acquired infections? How they prevented. 6. Define notifiable disease and give advantages and disadvantages of notifiable disease. 7. What is isolation of patient? How isolation of patient is done in hospital and private houses. 8. What are methods of epidemiological studies? 9. Write causative agent, incubation period, sign and symptoms, prevention and control measures, role of pharmacist in prevention of intestinal, respiratory, arthropod-borne, surface infection, STDs and HIV, AIDS, etc. Chapter 5. Introduction to Health System. 1. Define health system, objectives and major components of its. 2. National Health Program. Its objectives. 3. Give main activities conducted under National Health Program. 4. State ongoing National Health Program implemented by Director General Health Services. 5. What is palliative care? Give objective, functions, outcomes of national program for palliative care. 6. Write note on oral health program. 7. What is national organ transplant program? 8. National programs for visual impairment. 9. Write note on revised national tuberculosis control program. Chapter 6. Pharmacoeconomics. 1. Define pharmacoeconomics. Write objectives of pharmacoeconomics. 2. Explain methods of pharmacoeconomic evaluation method. 30. Write importance of pharmacoeconomic to stakeholders. 4. There are no more articles to read.